Today we're going to talk about a hot topic, fillers. Are they good? Are they bad? What's the deal? There's so much information on social media right now. It's buzzing everywhere. There's so much fear. Filler migration, ruining people's face with a pillow face, having unwanted aesthetic outcomes, risks like vascular occlusion. So what is it all about? Let's break it down piece by piece, element by element. I'm hoping I can help you make sense of it so that you can understand and feel confident in your choices. So let's start with number one, filler migration. What are people talking about? What is filler migration? It's this idea or concept that filler moves from the original site where it was injected to some other part of the body. So from one tissue to another, one zone to another. So what looked good now no longer looks so good. Is it real? Does it actually happen? Well, yes, it can happen. Under certain circumstances, in particular, if too much was placed in a particular area, or if the wrong product was used in the wrong area, or the wrong target was hit. And I know that sounds pretty simple, but there's actually a lot of science and thought that goes into those three things that I just listed off. So for example, using the right filler in the right place. If you're treating around the tear troughs or around the lips where there's a lot of movement, those tissues are very, very thin, there's not a lot of fat, the muscle is lying right underneath, you have to use a filler that's got a very light rheology. That's the word we use for fillers that talks about the flow and the texture. So you want to use a filler that's really light, very liquidy, that really doesn't have a lot of volume. It needs to be subtle. As well, the target that you're hitting. So for example, you have to know where you're going. If you're, again, let's say tear troughs, which is probably the most common area that we see filler migration, if you're in the wrong layer, you're not going to get the right result. So you have to know, are you targeting under the muscle? Are you going over the muscle? How close to the dermis are you going to target? So all of those factors really go a long way in determining the success of the treatment. So here's the reality check. Migration does not have to happen. Can a complication happen? Of course it can, but with proper planning and proper technique, complications should be absolutely minimal. So number two, let's talk about pillow face or buildup of filler that happens with time. So there's all sorts of postings online these days about people going in and having these huge dissolving sessions where everything is taken out of their face. Horrible images of before and afters. So let's talk about it. So what is the reality and why is this happening? I would say for the large part, most of this pillow face and overfilling is really all about improper planning, improper techniques, improper art. When we look at fillers and filler treatments, to me, it's like the perfect marriage of science and art. The science is understanding the filler, what are the properties, how is it going to behave over time? Is it going to absorb water? How much water is absorbed? Where's the target? Are we injecting deep? Are we superficial? And how is it going to behave over time? So the science is being able to understand all of those properties, understand the anatomy in detail so that you can predict what's going to happen over time. The art behind fillers is knowing what's aesthetically gonna look good. What do we correct? What do we leave alone? How far do we go? And most importantly, when do we say stop? So a huge part of the art and the science is knowing when to say stop. Filler treatments can be a little bit addictive. So for most people that have had it, you know how great it feels. It gives you an immediate pick-me-up. You feel great, you feel younger, you feel healthier. That feeling can be a little bit addictive and people want more. I've been doing treatments now for over 20 years. I've had many times where a patient comes right back and they say, this is great, doctor, but please give me a little bit more. And I've had to say, you know what? You look amazing. You're 95, 98% corrected, and we're gonna say stop right now. So that's part of the benefit of working with somebody who you can really, really trust and somebody who's got the expertise. We can help guide you, we can help direct we know what's in your best interest. It's really imperative that you work with somebody who's got the knowledge, who has the expertise and experience to help guide you through the process. Somebody with expertise, somebody with experience, so that pillow face does not happen to you. Another concern out on social media right now is the filler all over the face. So there have been some postings of MRI and ultrasound literally showing globs of filler seen all over the face. Let's break it down. What is actually happening here? Well, in most of those patients, first of all, the quantity of filler that has been injected is tremendous. They've had many milliliters of filler gel injected into their face. What's the reality check? Does it matter? Is this going to happen to you? As long as your fillers are planned properly and you're not overdoing it, it's highly unlikely that you're going to wind up with filler deposits all over your face. You won't need to break it down, and certainly not the way that patients that have had extreme injections have had to break down their fillers. I've had the benefit of being able to do filler treatments for patients now for over 20 years. I am a huge fan, and I will be the first to say that it has to be done properly and with great care. I feel that when treatments are done properly, it actually helps to support healthy, good quality skin. The fillers attract water, they help support the tissues, it helps as our tendons and ligaments start to sag, it helps us feel healthy, and the fluid and the water that these fillers bring actually contribute to our good skin health. So if you're seeing all this stuff on the internet talking about the risk and the fears of fillers, yes, there's a reality to it, but as long as your treatments are planned properly, so you're in good hands with somebody with expertise and experience and somebody that you can truly trust, 99.9% of this is absolutely avoidable, and it's all noise. So I'm a big fan of fillers. I do them on myself. I do them on patients all day long, every day. But I would love to hear about your experience. Do you have anything that worries you? Have you had a bad experience yourself, or something positive maybe you'd like to share with our audience? Please add your comments below. We'd love to hear from you, and we appreciate you sharing. Thanks so much for joining today and watching. See you soon.